Hello everyone. In today's episode of Microtalks, we will be studying what is meant by emerging and re-emerging infections. Infectious diseases are a global dynamic health problem, which we all know. The worldwide distribution of diseases can change dramatically due to the changing environmental factors. There is a lot of global travel or alterations, mutations in the pathogen, diseases that suddenly become prevalent are known as emerging diseases. Re-emerging diseases, on the other hand, include those which were previously under control but have risen again in incidence due to either increasing antibiotic resistance or failure in public health measures or various other factors which we will be studying in today's episode. Let us see what is the textbook definition of emerging infections. Emerging infections are defined as outbreaks of previously known diseases. They refer to infectious diseases that have recently appeared in a population or have existed but are rapidly increasing in incidence due to a variety of factors. Re-emergence of these diseases may happen because of a breakdown in public health measures for diseases that were once under control. They can also happen when new strains of known disease-causing organisms appear. Human behavior affects re-emergence. For example, overall use and overuse of antibiotics has led to disease-causing organisms that have become resistant to them. It has allowed a return of diseases that were once treatable and controllable. Let us look at now the definition of re-emerging infections. Re-emerging infections are defined as diseases that reappear after they have been on a significant decline. For example, you have malaria, TB, cholera, pertussis, and so on. Re-emerging infections were previously known to be under control. They are diminished in prevalence or they were eradicated but have re-emerged in newer geographical areas. This resurgence can be attributed to various factors like changes in public health practices, public health policies, vaccination schedules, environmental shifts, evolution of pathogens, increased trade and travel, changing human demographics, and so on. Addressing re-emerging infections requires renewed public health efforts, vaccine campaigns, enhanced surveillance to prevent further spread of these re-emerging infections. Let us have a look at the global examples of emerging and re-emerging infectious diseases. As you can see, the entire globe is dotted with infections which have either newly emerged or have re-emerged. When Anthony Fauci became the director of NIAID, he drew a map of the world for an emerging infectious disease threat. The first emerging infectious disease threat was the HIV. Since then, he has continuously updated the map, now showing the emergence of numerous infectious disease threats to illustrate as well as highlight certain infections that had emerged before HIV. Let us look at some of the emerging diseases in the past. So, in the Middle Ages, that is from the 5th to the 15th century, We have all studied and heard of the plague and the syphilis in the Middle Ages that had swept through Asia and Europe. Plague, or at that time it was called as the Black Death, was caused by Yersinia pestis, and there is a very interesting story about how Yersinia pestis reached Europe. And syphilis is the causative, Treponema pallidum is the causative agent of syphilis. Spanish flu is one of the well-studied examples of a pandemic that was caused in the year 1918 and 1919. And at that time, it had caused several deaths across the globe. The causative agent for the Spanish flu was H1N1 influenza virus. This pandemic had infected 1/3 of the world's population at that time. Then came legionellosis in the 1980s, which was caused by Legionella pneumophilia. This is an organism which spreads through water. Also known as, the disease is also known as Legionnaire's disease, which can lead to pneumonia and can be fatal. Then of course in the 1980s was the HIV AIDS, which we are all familiar with and which still is showing its presence world over. Yersinia pestis causes plague, Treponema pallidum, which was the causative agent of syphilis. Then again came H1N1 in 2009, which caused at that time the swine flu and later on the bird flu. So let us now look at some of the modern age examples of emerging diseases. Emerging diseases, once again, I will tell you, are diseases that have recently appeared in a population or have existed but are increasing in incidence or geographic range. HIV, although had first put its head up in 1980s, it still has had a profound impact on the global public health. Then came SARS, that is the severe acute respiratory syndrome. This viral respiratory illness emerged in the late 2002 and it was linked to a novel coronavirus, leading to significant outbreaks in several countries. MERS, that is the Middle East Respiratory Syndrome, caused by a different coronavirus. MERS was first identified in Saudi Arabia in 2012 and from there has spread to other countries. H1N1, that is the swine flu, in 2009 there was an outbreak of H1N1 influenza. This was caused by a novel strain of the virus leading to a global pandemic. Zika virus. This emerged in the early 2000s, which is still showing its presence once in a while across the globe. The Zika virus gained international attention due to the severe outbreak in 2015, and at that time it was linked to several birth defects. The deadly Ebola virus was first identified in 1976, but it had subsequent outbreaks in the west of Africa from 2014 to 2016. The Nipah virus infection, first identified in 1998 and 1999 in Malaysia. Nipah virus has since emerged in various regions, causing severe disease. The West Nile virus was first identified in 1937. It became more widespread in America, North America particularly, after its introduction in the early 1990s. This can be attributed probably to the changing weather and the climate conditions and so on. Chikungunya. In India, we are all very well versed with this particular disease. This mosquito-borne virus re-emerged in recent decades, leading to outbreaks in various regions worldwide. Dengue fever, also known as dengue fever, is another very well-known disease which is doing rounds in the city of Mumbai and in India at large. While known for centuries, dengue has emerged as a significant public health concern in numerous tropical and subtropical regions due to the changing climate and the changing urbanization and the changing human demographics. Some more examples: Campylobacter enteritis, caused by Campylobacter jejuni, is spread by contaminated water and food. Recently, it has been known to be linked to the Guillain-Barré syndrome, which had broken out in the city of Pune in Maharashtra, India. I have also put up a video in the past relating the Campylobacter jejuni with the Guillain-Barré syndrome. Then hemorrhagic colitis, which is caused by E. coli strain O157H7. This is a newly developed pathogenic strain, and it is the toxin of this particular organism that causes the hemorrhagic colitis. Peptic ulcers caused by Helicobacter pylori, mainly due to the poor sanitation and contact with infected animals. Peptic ulcers later on could also become malignant and lead to cancers caused by Helicobacter pylori. Hepatitis B, caused by increased unsafe sexual activity because of the changing human cultural conditions, socio-economic conditions. Hepatitis E, this is a newly recognized virus which has recently started doing rounds. Cervical cancer caused by the human papilloma virus. This is now probably I won't say it is more prevalent now, but there are increased incidences of cervical cancer caused by HPV due to increased surveillance. Then you have rubella virus, which is a variant of the rubella virus, which is now causing measles even in vaccinated individuals. So there is this mutagenic strain of rubella virus which has newly emerged. Coming to the factors that are responsible for emergence of the diseases. This is a complex phenomena which is influenced by a variety of factors. Some of the major players or the major factors that are responsible for the emergence of infections are environmental changes. This is caused due to alterations in land use, urbanization, deforestation, climate change. These can alter habitats and increase the human contact with wildlife, facilitating the spillover of pathogens and also facilitating their jumping of hosts. Globalization and travel. This is due to increased international travel, trade, tourism. This can spread rapid infectious agents across borders, making regional outbreaks which can become global pandemics. Human behavior. Changes in lifestyle such as increased mobility, urbanization, changes in the dietary habits can influence the transmission dynamics of infectious diseases. Antibiotic resistance, of course, very well known to all of us. The misuse and overuse of antibiotics in humans and livestock can lead to the emergence of resistant strains of bacteria, thereby complicating the treatment of the infection and also the efforts to control that particular disease. Zoonotic transmission. Many emerging infections originate from zoonotic pathogens, diseases that jump from animals to humans are the zoonotic infections. They are often facilitated by close contact with wildlife or livestock. Socioeconomic factors, mainly poverty. There is a lack of access to the health care because of poverty. Inadequate public health infrastructure in underdeveloped countries. This can hinder disease prevention and control the efforts by the public health system, thus allowing the infections to spread more easily. A high population density can facilitate the rapid spread of infectious diseases, especially in urban areas, in the slum areas with limited sanitation and healthcare resources. Variations in the climate can alter the distribution of vectors, particularly mosquitoes and ticks, which are known to carry infectious agents, and they can potentially lead to the emergence of diseases in new regions. Then there are mutations of the infectious agent, recombinations of the infectious agent to develop new strains against which the public health systems have not developed any means of control. Weakened surveillance and reporting, vaccination gaps, then certain cultural practices, dietary choices. So these are some of the factors that are crucial for emergence of diseases, and understanding these factors is important for implementing effective public health strategies to prevent and control the emergence of infectious diseases. Let us take a look at the re-emerging diseases. These are those infections that were initially under control but now are resurfacing due to many factors like mutations, environmental changes, globalization, changed public health practices, and so on. Re-emerging diseases, normally some of the notable examples of re-emerging diseases would be tuberculosis. Once considered largely under control in many countries, tuberculosis has re-emerged in recent years because largely due to drug resistance. You have multi-drug resistance tuberculosis strains, what we call as MDR-TB strains, that are doing rounds in the cities and in the countries. Also, there are factors like HIV which weaken the immune system, co-infection. These are some of the reasons why tuberculosis has re-emerged. And of course, there is decreased funding for public health. There is a lot of stigma still associated with the disease of tuberculosis, which makes the patients a little reluctant to go to the public health centers and take proper treatment. Malaria, another re-emerging disease, although it was always been there. So the efforts to control malaria have faced several setbacks, particularly in regions where insecticide resistance has developed and drug resistance has developed. Also, changing in the climatic conditions the world over, changing in the human demographics has also been one of the major factors for the re-emergence of malaria, and it has led to increased prevalence of this disease. Global warming and urbanization is one of the causes for increased prevalence of the dengue fever. Dengue has re-emerged in various tropical and subtropical regions, resulting in increased outbreaks. Cholera outbreaks have resurfaced in areas where there is inadequate water and sanitation is always a problem, and also demonstrating the impact of environmental changes and civil unrest has led to the outbreaks of cholera. Measles was once considered to be eliminated in many regions, but it has seen a resurgence due to, again, as I said before, mutations in the virus, changes in the genetic structure of the virus, increased travel. Besides that, there is also a lot of vaccine hesitancy and a decline in the vaccination rates. Pertussis or whooping cough. In some areas, the incidence of this disease has increased, partly because of declining immunity from the vaccines and natural infections. The West Nile virus has spread widely in North America and Europe due to changes in climate and urbanization that has led to an increase of mosquito populations. There was a major outbreak of the Zika virus in 2015 and 16. Thereafter, Zika has shown the potential for re-emergence in new areas due to changing environmental conditions and increasing mosquito menace and increasing mosquito populations. The hantavirus pulmonary syndrome is caused by the hantavirus, and incidents of this disease have increased in certain areas which have been driven by factors like rodent population. Then the control measures of the rodent population have failed, and also climate change has led to increased hantavirus pulmonary syndrome. Nipah virus has not actually caused widespread outbreaks recently, but it continues to be a concern due to its potential for re-emergence in areas where there is intense agriculture, or there is close contact with bats, and places where there are live animal markets. So these are the places where these continue to be a concern for the potential outbreak of Nipah virus. Then you have the human metapneumovirus, which is a virus that belongs to the Paramyxoviridae family. The human metapneumovirus, better known as HMPV, was first identified in Netherlands in 2001 and is known to cause respiratory infections, particularly in children and adults. HMPV is associated with symptoms which are similar to those of other respiratory viruses. There are cold-like symptoms like cough, fever, and in some cases can lead to severe respiratory distress. So HMPV has recently shown outbreaks in the city of Pune and Mumbai in Maharashtra, India. It typically spreads by respiratory droplets from coughing and sneezing, as well as through contact with contaminated surfaces. Currently, there is no specific treatment for HMPV, and management of the disease focuses on relieving symptoms and preventive measures like good hand hygiene, avoiding close contact with infected individuals, and so on. So these are important in reducing the spread of the virus. These diseases highlight the ongoing challenges in the public health and the importance of monitoring, prevention, and vaccination efforts to control infectious diseases as environments and social conditions evolve. I hope you have liked today's episode on emerging and re-emerging infections. Please do like, share and subscribe to my channel. Looking forward to bringing you more episodes of Micro Talks. Thank you for watching.